If you're searching for the best podiatrist in South Orange County right now, there's a good chance you're already in pain and you don't have time to figure out what separates a truthfully skilled foot and ankle specialist from someone who's just giving you a generic answer and sending you home. That distinction matters more than most people realize. Foot and ankle problems have a way of compounding. A misdiagnosis early means a harder problem later. A surgeon who only knows one technique fits every patient into the same technique, whether it's a right fit or not. And when something goes wrong, the window to correct it can close. By the end of this video, you'll have a clear framework for evaluating any foot doctor near me results, and you'll know exactly what question to ask before you book. Most patients assume that any licensed podiatrist is equally qualified to handle their condition. They look at the website, see a degree on the wall, and assume those credentials are equivalent. That assumption is doing a lot of work, and it often leads patients to the wrong provider for the complexity of what they're dealing with. Podiatric licensing and podiatric board certification aren't the same thing. A podiatrist can practice legally without completing any additional training required for a FACFAS certification, fellowship level training in the foot and ankle. That training represents a significant difference in surgical competency, diagnostic depth, capacity to handle complex cases. If you're dealing with anything beyond a routine ingrown toenail, this gap has real consequences. Patients with peripheral neuropathy, wound care complications, or structural deformities often end up in the wrong office first. They get a treatment that addresses the symptoms and not the underlying cause. They've spent months going backwards before someone identifies what's actually happening. That's not bad luck. That's a predictable result of seeing a provider whose training wasn't matched to the problem. When you're evaluating podiatric surgeons in South Orange County, the first question is whether they hold board certification. The second question is whether they hold additional certification or areas relevant to your condition: wound care, reconstructive surgery, limb salvage. Those aren't decorations. They represent training that distinctly shapes the diagnostic process and the range of the solutions available to you. A foot and ankle specialist with 25 years in practice, double board certification in podiatric surgery and wound care, and a deep experience in the most complicated cases is not the same as a general podiatrist. Treating them equivalent is a mistake that costs patients time and recovery. Certification tells you what a surgeon is capable of. The next question is whether they're actually using the full capability in your care, or whether they have one answer for every problem. Most patients assume that recommended treatment is the recommended treatment. If a doctor says surgery is indicated, the assumption is that there's one standard surgery, and the question is simply whether to schedule it. That assumption doesn't hold up. Foot and ankle surgery Orange County patients receive varies widely depending on the training and the toolkit of the surgeons they see. A surgeon who has mastered one technique will reach for that technique consistently, regardless of whether a minimal invasive alternative exists or whether a conservative approach tried in a specific sequence might resolve the problem without any surgery at all. The options you're presented with are bound by the options the surgeon knows. If a podiatric surgeon knows 5 or 10 approaches to a given condition and another knows one, those two patients aren't getting the same care, even if the diagnosis is identical. And in most cases, that patient has no way of knowing which situation they're in. The right foot and ankle specialist walks you through options, not just one path presented as the only path, but a set of approaches calibrated to your specific anatomy, your lifestyle, your recovery constraints, and your goals. That conversation should happen before any approach is scheduled. If you're not having that conversation, you're not getting patient-specific care. Equally important, your access to the surgeon shouldn't end when you leave that appointment. Direct access between visits is a clinical differentiator. When something changes or a question comes up at night, the ability to reach your doctor directly affects your outcome. A practice that gives patients the physician's personal cell phone is closing a gap that causes real complications when it's left open. Now that you know what it looks like in terms of training and approach, here's the next process to evaluate any best foot surgeon for South Orange County results before you pick up the phone. If this is helping you think through your options more clearly, subscribe before we get into tonight's test. More videos like this one are coming, and the next one's going to answer the question that trips up a lot of patients in South Orange County specifically. Most patients don't have any framework for evaluating the foot doctor near me results. They look at the STARS ratings, the photos, they make a call. This process gives you something more useful: a set of specific answerable questions that surface the information that's actually predicting your outcome. Go to the website or profile of the podiatrist you're considering and look specifically for board certification or letters behind their name of credentials. That credential indicates completion of additional training in the foot and ankle surgery. If it's not there, note that and factor it accordingly. Look at what the practice specifically treats. South Orange County Podiatrist, who lists limb salvage, reconstructive surgery, peripheral neuropathy, wound care alongside routine procedures, is demonstrating a breadth of case complexity that general practices don't carry. Breadth of listed specialties reflects depth of actual training. Before you book, call the practice and ask 2 questions directly. Does the doctor discuss multiple treatment approaches before recommending one? And can patients reach the doctor in between appointments if something comes up? The answer to those 2 questions tell you more about the quality of care you receive than anything on the website. When you're in the appointment, do not leave until every question is answered. A physician who stays in the room until you fully understand the plan is a physician who's treating you as a partner in your own care. If you feel rushed, that is the information. Finding the best podiatrist in Orange County is about matching the complexity of your condition to the depth of the physician's training, confirming they bring a full range of options to every case, and having a real access to them when you need it. Those 3 things predict whether you walk away with the right answer the first time. If you're in South Orange County and want to work with a foot and ankle specialist who operates this way, Podiatry Hotline Foot and Ankle is the practice to contact. And if you're trying to understand the differences between podiatric surgery and orthopedic surgery for a foot and ankle problem, the next video answers that question directly. Watch it now.